My name is Katto. I work with the Ministry of Health in Uganda, and I'm the presenter for this abstract effectiveness of caregiver mental directly observed treatment and support model on viral suppression in Uganda. In terms of the background, viral load suppression remains a challenge among children and adolescents. Those with undetectable viral load receive intensive adherence counseling, but with non-compliance and low resuppression rates of 23%. Caregivers sometimes fail to attend these sessions due to environmental, personal, psychological, financial, and other child-related challenges. Directly observed therapy has shown great improvement in treatment outcomes through improving literacy and supporting drug administration challenges using a peer-to-peer approach. We assess the effectiveness of the Caregiver model in viral suppression in Uganda. In terms of the methods used, we conducted a mixed method implementation effectiveness type 2 study among caregivers at 5 health facilities that provide in central Uganda from June to December 2022. We identified caregivers of unsuppressed children and adolescents 2 to 15 years and paired them with caregivers of those with suppressed children from the same area within a radius of 2 kilometers on a ratio of 1 to 5. We trained these caregivers of the suppressed children as mentors in providing treatment literacy, directly observing daily treatment, and they conducted DOTS for a period of 60 to 90 days, and also provided linkages and referral to livelihood support. We further analyzed the viral load results after the third ISC, or intensive adherence counseling, and those who were still unsuppressed were checked for drug resistance. The results of the study show that a total of 30 caregivers with 49 unsuppressed children were enrolled on the study. The average of the age of the children was 8.8 years, 20 were males and 29 were females. Of the 77% were on first-line treatment, 20% were on second-line treatment, and 77.6% were on a DTG-based regimen. The mentors identified lack of information, negligence, low literacy, treatment literacy, and lack of a supportive environment at home as the major factors for non-suppression. And after a dose intervention, 57%, those of 28 children, had an undetectable viral load. 36.7% had suppressed with a viral load of less than 200 copies, and 1 was lost to follow-up, and 2 had unsuppressed viral load and confirmed having drug resistance. In conclusion, caregiver DOTS can effectively support caregivers of suppressing children and adolescents to improve treatment outcomes through improving literacy and supporting drug administration. Therefore, there is a need to support caregiver mentors to provide peer-to-peer support at the household level, which reduces the burden on the overloaded health facilities. Thank you to the study team members and also the donor.